Are you contributing to infections or are you helping with infection control? Let's delve into the topic about infection control, which you'll find in your fundamentals class. Don't scroll. Finish this reel so you can learn about it. When you hear infection control, just think about it this way. These are the actions that nurses take to prevent the spread of microorganisms between themselves, between the patients, between the visitors, and honestly, between all of the other things in the environment. Does that make sense? As healthcare providers, we have only one goal, and that is to break the chain of infection. So let's actually talk about what the chain of infection entails. 6 components that are linked to each other like a chain, and as long as they stay together, infection will occur. So the first component is the infectious agent or the pathogen, and this is a microorganism that has the potential to cause sickness. So things like the flu, norovirus, C. diff, those are all pathogens. Number 2, you have a reservoir, and this is where that pathogen lives or that infectious agent lives. So if a person is sick, that infectious agent may be living in them. So a person who's already sick with the norovirus or the flu may be the reservoir for that flu virus. Next in line is the portal of exit. And this is how the pathogen makes its way out from the reservoir and goes out to infect other people. This could be as easy as sneezing, like through the nose or through the mouth. So if a patient sneezes, achoo, all of those pathogens go into the air and other people can actually inhale and get sick. The next in line is the mode of transmission. So how exactly did this pathogen get from patient 1 to patient 2? So if it was through sneezing, the patient got it in the air. If it was through an equipment that was not cleaned properly, the patient touched it by contact and picked it up through the equipment. Our next is the portal of entry. So how did the pathogen get into the other person to actually make them sick? And if this was through sneezing, the other person inhaled it and now it's gone into their lungs and respiratory tract and has the potential to get them sick. Lastly, we have a susceptible host, and these are people who are at risk of getting the infection because they don't really have a way of fighting it off. And honestly, that could be me and you because we're not in the best of health and our immune systems are not where we need it to be. But older people and children with low immune systems are definitely at risk of getting infections. And this is the whole chain of infection. So join me for the next video where we actually talk about how to break this chain of infection. This is where we dive into hand washing, PPEs, donning, and doffing. Make sure you share this with another nursing student who may need it. And honestly, save this for future reference.